So if you're able to listen to me, let me know in the chat box. And I'd also like to know where you're joining from, your name, and thank you so much for attending today's All Stars Live. So today is a day of questions. We are going to look at every aspect of asking questions. So it's a day you can ask me a lot of questions, and I will ask all of you a lot of questions as well. So we'll be looking at the do's and don'ts of questions. And questions are very important in OET speaking, because we do have to ask a lot of questions for the role play to be successful, right? So let me know in the chat box where you're joining from. I'm just waiting for the live feed to start. It's a great day, and so it's good morning, evening, afternoon, depending on where you're joining from. And excellent. So, right. Thank you, everyone. Flessy, Ashish, Ramya from different parts of India, Ramya from Kerala, Devin from UAE, Parveen from KSA, Nifita, nice to see you as well, Neha from Pakistan, welcome, and Jansi also from the Kingdom of Saudi Arabia. Hello, Flessy, Manju, Ahmad from Sudan, very good. Princess Osas from the UK, Sinu, Mahmood, Beauty, Rami, Jaslyn. Jaslyn joins from Velu. Hello, Jaslyn. Nice to see you. Saru from Nepal, Manju from Mumbai, Ansi from my own home state, Kerala. Mahmood, you're welcome, Mahmood. Thank you so much. Apple Joy from Philippines. Hello, Kavya. Nice to see you. Jyotisha, Parveen. Parveen, yes, I can do listening part C and B, but perhaps in another session. Lioness from Zimbabwe, Darlene from KSA, and Farah from Pakistan. Welcome, everyone. And today is a great day when you can ask me a lot of questions on OET speaking. So let's get started. I'll be looking at the feed as you send your chat. At the same time, hello, Megar from Nepal. Very good, lovely place. And I have a lot of students from Nepal, many of whom work in the UK now. Excellent. So I have a question for you. What can I do for you? Hey, Jobin from Manakad in Kottayam. Nice to see you as well. What can I do for you? This is my question, but I want you to also identify what question it is. Do you ask this question in OET when you practice speaking? It's a common question that we all ask at different times. So, what can I do for you? Very good. And I've got a few more questions, and then I will ask you another question on what these questions are. So here comes the second question. What do you think about questions in OET speaking? Please feel free to type in your answers. But we'll also be analyzing these questions in a moment. Right. And finally, are you ready to ask the right questions? I see some excellent chat and feedback. Well, Jane is asking something which is not related, but I suppose you can reset all the parts. Yeah, very good, Maria. It's open-ended questions, yes. I'm not sure which one you're talking about, but certainly that's something we'll be addressing today. Excellent. Now, you have 3 questions on the screen. Try to think what these questions are or what kind of questions these are. And if you can categorize them, this is this kind of a question, this is this kind of a question, that would be excellent. Give it a try. All the brilliant OET candidates, test takers, health professionals out there. The first question is, what can I do for you? What do you think about questions in OET speaking, and are you ready to ask the right questions? So what kind of questions are these questions? That's my question for you today. Sounds very interesting. Manju says, is it interacting? Yeah, of course, they are all interacting questions, but I want a little bit more nuanced approach. Try to analyze these questions and what kind of questions they are. Flussy, yes, open-ended, but which one is an open-ended? First two are open-ended and last one is a closed question. Neetu, I know, very good. Brilliant answer, thank you. You're almost there. Although I'll be discussing a subtle differentiation as well. Yes, Ramya, that's right. MGAD says getting information, absolutely. Hello, Sima. Rajeshwari says direct and indirect questions. Yes, in a way, yes. I see your answer, Flussy. Yes, thank you. Maria says asking, reflecting, closed. Third is closed. Flussy, yes, I totally agree. Maria, you're almost there. Jana, situation is relevant. Okay, so I suppose you are saying that it depends on a relevant situation. Right. Yes, Neha, that's right. Excellent. Jean Prados is offering self. I hope you mean offering help. Right. And Beauty says the first one is an introductory question. Excellent answer. I really like that. And it is an introductory question. Beauty Goswami, thank you so much for that answer, and we are on the same page. So that is kind of an introductory question, something you start the conversation with. Darlene says getting the main concern of your patient and empathizing. Okay, yeah, of course you can use these questions to empathize. And had in, right. Okay, so we've got the first one correct. Janie says fluency and professional manner. I suppose you mean these are questions you would ask in a professional setting. Okay, good. And so many of you did mention about open-ended questions. So these are open-ended questions, to be precise, but the second one is absolutely an open-ended question. And the third one is a closed question. Neha is from Pakistan, our neighboring country. Thank you for joining today. Probing question, Finian. Yes, you call them probing questions as well. So I've got more activities for you today, everything around questions. Try to make some introductory questions on your own. Let me see how many you can come up with. Type in all the introductory questions you can think about. It doesn't matter if all of them don't fall in the category of introductory questions. That's absolutely fine. Give it a try. I'll give you a minute to do that. So those who are just logging in, welcome to today's sessions, and we are dealing with the do's and don'ts of questions. Right. Good to see more of you joining from across the globe. How can I help you? How may I address you? How are you feeling today? Why you chose nursing profession, Neha? That's more of a warm-up question. But yes, I accept that. How may I help you? How may I help you today? What brings you here today? How may I assist you? How can I help you today? What made you come here today? What brings you here today? Hello, how may I help you? What brings you here today? I'm your doctor for today. How can I help you? Hi, have I seen you here before? What can I do to make your day better, Krish? Thank you. Good question. Is that clear about your concern? Amma, that's a good question, but I don't think we may use it right at the beginning. How may I assist you? How may I help you? So, how may I help you takes the lead. Most questions are around how may I help you and what can I do for you. Ramya says you seem a bit worried. How can I help you? Right, yeah. Nisu says, how can I help you? How are you feeling today? What brings you here today? My name is Princess Osas. Your GP has referred you to me. How can I be of help to you? Hi, I'm a nurse on duty. All right, it's not a question though. May I know your concern? Yeah, what happened to you? It sounds a little bit too direct. You can make it, a bit more softer. May I know your good name, Shamini? It in many parts of the world we use the term good name, but I suppose it's not proper English. So just ask, may I know your name, and avoid the good name. I think it is an Indian influence. What's bothering you today? What brings you here? I can see you're worried. May I know why? May I know the reason behind your visit? May I know your name? What can I help you with? Thank you so much for all the introductory questions, and you are all doing a great job. Thank you very much. Okay, so this is a question that is often asked. Are introductory questions part of the task? So, do you get to ask an introductory question in the role play card, or do you have to bring it on your own? So, we are going to look at two ways in which it can be done. There might be prompts in your role play card which says something like "greet the patient," as you see on this slide on the screen. In such a situation, you are specifically asked to have an introductory conversation, which would certainly include introductory questions. So that is a possibility. Now, if your role play card does not have such a prompt, still you can have an introduction at the beginning. Introductions are important in the role play, and that sets the tone. Certainly, so either way, you need introductory questions. Sorry for the tongue twist at times. So I hope you have an idea on some of the questions which will get you started with the role play. And right. Here are a few more examples on the screen for you. Hello, my name is Dr. Steve. How can I help you today? What can I do for you? How would you like me to help you today? How are you doing? These all can be used in introductions. use it in the right context where it would be relevant. So it's not a good idea to memorize these questions and then use it in any situation. I've seen a lot of candidates do that, which is not advisable. So, you can certainly have that as part of your repertoire. So if you have a collection of useful language, which can be used, certainly collecting such questions is a good thing to do. Hey everyone, I'm sorry I couldn't follow all your chat, especially those who are logging in right now. So I've got a role play card on the screen for you, and we'll be trying to do some question activities based on this. As you're aware, we have 3 parts in the role play card. So you have the setting and the background and the task. So these are the 3 parts. So the setting says surgical ward. So that's the setting in which this role play is set. And the background information says your 52-year-old patient sustained a left distal radius fracture after a fall at home. He or she has undergone an ORIF surgery. So that's an open reduction internal fixation surgery and has a cast in place. The patient is worried about managing at home. So this gives us a background, and this an adjective which tells us about the mood of the patient. The patient is worried. So you're going to talk to a patient who is worried, not very excited. In which case, let's quickly look at the tasks, and we'll be doing some of them as we proceed. So the first one is find out about the patient's concerns. Okay, so we will take that particular role, that task, and try to look at how we can ask various questions based on that. So what techniques would you use to begin the task? Ideally, you should begin with open-ended questions or statements. We have discussed that a while ago, so I'm not going to keep asking it, but we'll be doing more activities based on that. Okay, so at the beginning of a task, remember to use open-ended questions, sometimes statements as well. And what are the benefits of doing that? Firstly, it allows the patient to respond openly, allows them to include their thoughts and feelings, and it's not too focused on content. So we are not going to be too much worried about what they say. Rather, you have to let them speak. Elaboration is encouraged. Now I'd say that certainly we have a time limit. So you shouldn't allow them to keep on elaborating for 5 minutes. That's not a good idea. Certainly you'll have to move on, use signposting or some of the techniques of providing structure. Indeed. However, at the beginning, a little bit of elaboration is very good. I see your samples, and I'll come to them in a minute. All right, so I've got some examples as well for you. What's bothering you? Tell me about what's troubling you. Could you explain your fears? And right, let me read what you have written. I see that I see that you seem worried. Could you tell me what's bothering you? Yes, Mamta. Neetu says, hello, good afternoon. I'm Neetu and I'll be your attending nurse today. How are you feeling today? All right, but we have to move on to the open-ended questions. And Lipa says, I get the feeling that something is worrying you. Could you please tell me what's bothering you? Yeah. Flessy says, you seem worried. Could you mind? It must be, do you mind? Okay, do you mind telling me what is bothering you? Right. How are you feeling today? Ramya, can we move on to more open-ended questions, please? But thank you for the reply. You look worried today. Do you mind sharing your concerns? All right, Judith. What's the matter? Okay, right. So these are just examples for you, but you can have a lot of other open-ended questions as examples as well. Now, for instance, let's look at these examples. What's bothering you, or tell me about what's troubling you, or could you explain your fears? Patients will start telling you a little bit more about what they're going through, their narrative, their story, and that is very important, will be very important later in the treatment pathway. And okay, so let's move to another subtle area where, again, this is again an open-ended question, but slightly more focused. So as you keep on asking open-ended questions, it's a good idea to narrow down. It's not a good idea to keep on asking more and more open-ended questions of the same kind. We need to narrow our approach, and that is called focused questions or directed questions. So they are kind of open-ended questions, but with more narrow approach. And they can also be used to ask for additional information or clarification on the points raised during the narrative. When the patient was replying to the open-ended questions, you are asking, they would have given you some leads which you need to focus on. So that's what comes next. Now, don't get me wrong, it doesn't mean that the first one is an open-ended and the second one is a focused question. That's not the idea. You can have a few open-ended questions if required. That's absolutely fine. But after that, once we have the narrative, we keep, narrowing the focus. Right. Okay. So here are some examples of focused questions. We are still on that task. Does something make your worries go away? So that gives you an idea that in your previous question, the patient would have told a little bit about their worries. And in a reply to that narrative where they told you about their worries, you're asking this question. Does something make your worries go away? So from the whole narrative, we are now moving on to a particular aspect which the patient touched upon, his or her worries. And so we are just probing a little bit further into it, asking a little bit more about the worries. Or what do you think makes you nervous? So the patient would have mentioned about nervousness as a reply to the first question, which would have been an open-ended question. So you have picked on nervousness from that conversation, from that narrative, from the story of the patient. And now we are asking a little bit about the nervousness, which the patient did mention. And When did you go through such thoughts before? Here again, the patient would have told you about certain thoughts. And so you're now asking, when did you go through such thoughts before? So the thoughts came up in the narrative with an open-ended question, which you would have asked. And now you're probing into those thoughts or when those thoughts came on before. I hope you're following, and if you have any questions, ask me if you don't understand. Very good. I want you to come up with your own examples as well for all these segments, which will help you with your preparation. Okay, so let's move on to something which we would use to end the task. And as we discussed at the beginning, we will use closed questions towards the end of the task. Remember, we are dealing with a particular bullet point, a particular task, a specific task. And there are other tasks as well. So you have started with an open-ended question, moved on to a focused question, and now you're moving on to closed questions. So what are closed questions? So typically they are yes or no answers, questions which should give you a short response, yes or no. And it's used to elicit additional information omitted by the patient. So you asked open-ended questions, they told you a little bit about their story, you picked on a few aspects, such as their nervousness or the thoughts they have, and then you realize that there's something which the patient did not touch base upon. So that's when you ask a closed question. And it's helpful to identify or rule out specific aspects of drug history, past medical history, or family history. Yes, so for instance, are you allergic to something? So that's a good way. And too many closed questions will make the consultation very rigid. So you should avoid asking a lot of closed questions. That's not ideal. So here are some examples for you. Do you feel better now? So either you feel better or you don't. And the answer could be yes or no. I feel better now. No, I don't feel better now. Are you allergic to any drugs? Have you suffered a fall before? Have you undergone a surgery before? Close questions, which will help you to wind that segment, that particular task. Right, everyone. So if you really enjoyed this lesson, don't forget to like and share with your friends or colleagues who might also want to prepare for OET. So this takes us to something called the open-closed cone. So it's like a cone. It's like a triangle which tapers to the fag end. So this is a good way to remember. Every task, start asking open-ended questions, move on to focused or directed questions, and end it with closed questions. I remind you, it doesn't mean that only 3 questions have to be asked. You can ask more questions, but this is the route to be taken. Don't begin with a closed question, rather, begin with open-ended questions, move on to directed questions, and end with closed questions. Does that make sense? I hope it's clear, and I look for some of your comments. Are you in pain? All right, Jean or Jean I'm not sure how you pronounce it depending on which part of the world you are from. Okay. Beauty says summary. So are you talking about summarizing at the end of a task? Certainly you can. So it's a good way. You have to do that. So perhaps at the end of asking questions, you can move on to summarizing. Devin says, are you having more medicine? Okay, great. So if it is a task where you have to summarize, go ahead and summarize, and then you move on to the next. So on the screen, you have another task from the same role play card. I want you to type in open-ended questions for this task. And this is a validation of what you have learned. Please give me more examples of open-ended questions for this task on the screen. Find out what support the patient has at home. Example, housework, grocery shopping. Suggest support can be arranged if appropriate. So that's what the task is about. And now it's your time to type in the open-ended questions that come to your mind. Tansim is asking, if in the role play, said your patient is this means, I know the patient. Yeah, your patient means you have seen the patient, a familiar patient. Can I ask, have I made myself clear? Does something make your worries go away? I suppose you are giving me close questions from the previous task. Okay. Is there anybody at home that can help you with household chores? Maria, can you rephrase it into a more open-ended questions, into a question? Although it can pass off as one as well. How often do you do housework at home? How often do you go for shopping? How do you intend to manage with activities of daily living? Are you doing any activities at home? Please, can you tell me if there is anyone helping you with your daily activities in your home? Who normally does the housework? Do you have anyone to help you around the house? Do you have a support system? How do you manage your housework and grocery shopping? Thank you, Thomas. Now, coming back to another query, do you have any other support system at home? How do you usually spend your time, especially during weekend? Could you tell me how can I manage your daily activities like household activities, grocery shopping, etc.? Would you mind telling me where do you usually get your food? How do you manage your household work? Okay, so thank you so much for all the answers. And I'm not going to critically analyze each of those, but there are a lot of open-ended questions, which is a good sign. So I'd say you should ask yourself this question. If it is an open-ended question that you have asked, then they will be able to elaborate a little bit. Tell their story, not just one word, not just a sentence, a little bit more. So those are open-ended questions. Okay. Now we are moving on to Focus questions. So think of a little bit narrowed question which you can work on. Okay. So these are also open-ended questions, but the focus narrows down a little bit. Right. MG is asking if I can give an example. Sure, for open-ended question. Could you share your grocery shopping routine and household chores? Okay. So MG, I'll give you examples of all three at the end of this task, once we have covered a close question as well. Princess asks, can I please ask if you have been assisted with household activities, as I could make necessary arrangement for your support. What do you feel about that? Okay, a bit too much to take on. Okay. So it could be rephrased a little bit to make it sound a bit better. Can I ask you if you require any assistance for household chores? Should be fine. Okay. You're welcome, MG. And let's now move on to the last segment of the cone, which is close questions. Think of close questions for this task. What all close questions can you ask? So you can perhaps ask questions like, do you shop every week? All right. Do you have a social support card? A lot of questions. Do you live alone? Very good. Judith? Do you eat meat? Are you a vegetarian? Would you mind if I give some suggestions? Niveta, yes? Okay. Do you have anyone at home to help you with activities of daily living, like housework and grocery shopping? Dira, yes, thank you. Ricardo says, can you get a shower by yourself? Very good. Can I assist you? Devin, yes, thank you. Mary says, do you have a helper at home? Brilliant. Lots of close questions. Excellent. Can you do your shopping alone? Shadon, yes. Thomas says, can I organize to someone to assist you? Can I arrange someone to assist you? That would be better. Thank you, Thomas. Harriet says, who assists you with housework and shopping? Okay. That might sound a little bit more open though. Hi, Shika. Rachel says, have you already gathered help and support from your family or from your neighbor? Okay. Maria says, how often you do your grocery shopping? Ramya says, are you able to do shopping alone? Good. Darlene is asking, would it be okay if we arrange assistance to help you at home? Beauty, are you consuming? So does that mean, do you consume alcoholic beverages or something of that sort? I suppose. How do you manage your daily showering, I suppose? Lisa, there's a typo there though. Are you able to prepare your own meals? Ricardo, thank you very much. Nice question. Okay, good to see all the questions which you have typed in, and I'm really hopeful that this is helping you and do the speaking task much better. So we're now going to look at an interesting part. We're looking at a few do's and don'ts before we wrap the session, but there's a lot for you to learn even from this segment. Right. I'll follow your chat as we progress. And now this is like a quiz. You will have to identify the question type. So we are still following the same task. As you see, find out what support the patient has at home. Now what you have to do is you have to tell me what kind of question this is and whether it is appropriate or inappropriate for OET speaking. Two tasks actually, which is not a good idea, but identify the question. Go ahead, tell me what kind of question this is. Today's more like a brain gym. You're into a lot of activities and that's going to really help you. Think, type. Shadin says open-ended. Fatima Noor says it's closed. Open, closed. So that was Sarah. Darlene. Niveda says closed. Rachel, open. Maria, closed, yes. Ricardo, open. I'll give you a clue. I'm not asking whether it's open-ended or closed question in this question. Something else. Look carefully. Read the question carefully. Very good. Uchaya says it's a compound question. That was very brilliant of Uchaya Uku. I hope I have pronounced your name correctly. Okay. See, he has got it right. So this is a compound question and you should not ask compound questions in OET speaking or generally either. Now, what are compound questions? What are compound questions if you have any idea of it? I'm sure some of you are aware of it. Lisa Conte says double questions. Yes. So you have two aspects here. Assistance with housework or grocery shopping. So what do you expect the person to answer? It's going to be confusing when you have compound questions. However, we might have a tendency sometimes to ask compound questions. Do you have a headache or a back pain? And so we're putting them in a confusion wherein they have no idea, should I talk about the headache or about the back pain? So remember, try to avoid compound questions. And Judith is asking more than one question at a time. Yes. Farah, in which we ask two questions at a time. Are you asking when can we ask two questions at a time? I suppose that's what you're asking. Well, try to break it into two questions. Yes, when you're giving them choices, yes. But when you're asking questions which require more elaboration, no. So these are not two, choices as such. Rather, they might need specifically a different kind of assistance as well. Okay. So let's look at this one. Tell me about the kind of assistance you may need. What kind of a question is this? I totally agree with you, Ricardo. It depends on the context and the setting and what you're trying to achieve. Let me know what you think of this question that you see. Dolene says it's elaborative. Saju says open-ended. Open, just name. MG, yes, open. Soundarya K, open. Lisa, open. Divine. Ruhi. Niveda. Okay. Rachel, Farah. Very good. Very good. You got it right. It is an open-ended question. Thomas Jones, we aren't yet there. We are about to. Okay. Here's your third question. You can't go out for shopping. Can you? What kind of a question is this? I think I'll give you another clue because you're still beating about the bush. It's something different, not a question which we have discussed yet. Mamta, yes, I agree with you. There's a tag. Saundarya says it's judgmental. I agree, absolutely. Yes. So we call it a leading question. Yes, Rachel. So these can be judgmental at times. So what are leading questions? Leading questions are those questions which kind of force you to give an answer. In this case, you can't go out for shopping, can you? Which means you're forcing the patient to say they can't, instead of giving them the options to answer openly. Assuming question, yes, Rachel, you're assuming that this patient cannot go out for shopping. So those are leading questions. Yes, Niveta, leading question. Fatima, it's like emphasizing. It's emphasizing, but not in the right way. Negative. It could sound negative because, as some of you have mentioned, it could border on being judgmental, which is not a good idea. It's not a good thing to be judgmental either. So avoid those scenarios where we jump to conclusions. Yeah, a few more questions for you. How often do you need shopping to be done? Type in what you think this is. We give directions based on our judgment. Okay. Contrast. Narrowing. Fatima. Okay, let's see. Yeah. So this is a directed question or a focused question. So it's still an open-ended question, but not with a very broad perspective. The perspective has narrowed down a little bit. So the question is about how often. So it's the frequency of shopping to be done. Does the patient require daily shopping, or is it weekly, a couple of times in a week? The frequency. So they will tell a little bit more about the frequency. Certainly, it's not a yes or no question, but there isn't too much to narrate. There's in a big story. certain shopaholics might have, though. Yeah, certainly you need a particular answer. Okay, so I've got a few more questions before we wrap the session, and I'll open the floor for more questions from you on questions. What is this? Do you have any pets? What kind of a question is this? There you go. MG, Divine, Kavya, everyone. Darlene, Erika. Yeah, it is a closed question. Princess, Rads, Niveta, Ruhi, I'm afraid it is a closed question. Sounded it's not a directed question. It could have been like, if you ask, tell me a bit more about your pets, but this is more of a yes or no question. Okay. So here's another one. We have a lot of questions today, and I think you enjoy learning a lot, which will help you with your OET preparation and your clinical practice as well. Okay. Let me know what question this is. So the task has changed, if you have noticed. Ask about the patient's wish to return to work. And in the brackets, we read that after a break following workplace injury. So this person sustained an injury at work, and now he wants to go back to work again. All right, let's see. It's a focused question. Right. Now, those who have written open-ended, it's not wrong either. It's equally acceptable. It's just an open-ended question with a little bit more narrow focus. Judith, yes, that's right. It's a direct question. So here's the next question for you on the screen. Aren't you excited about returning to work? Now, this is something we have discussed a while ago, so it should be familiar to you. Okay. MG and Divine have come up with answers. I think more and more of you are typing. Tasneem, Darlene, yes, absolutely. So it is a leading question. Judith, I see. Right. Here's the next question. Do you think you can continue in the factory floor? Okay. I see more of you getting the answers correct. We are almost running out of time, so I'm not going to read all your answers, but I'm keeping a tab on them. It is a close question. What do you think about your recovery so far? One of the last questions for the day. It's an open-ended question. The patient will narrate about the recovery so far. It was uneventful or had some problems, everything will be detailed. And the last question for the day. Do you want me to write to your manager and give some pain medicine? Don't go wrong here. I know you have learned a lot today, so this is the time to showcase your learning. What kind of question is this? Do you want me to write to your manager and give some pain medicine? Princess, think a little bit closely. Kavya got it correct. Dira, Tasneem, Saima, Niveta, all of you have got it correct. Judith, yes. So this is a compound question. Mamta, Nigat, thank you everyone. So if you have any questions about questions, let me know. I'd be happy to answer any questions you might have about questions of OET speaking. And it's very important to learn how to ask the right questions, as we have seen at the beginning. And IRS Group, as a premium preparation provider, would be happy to assist you with your preparation. So we have intense training programs. So if you would like to have a free demo class, let us know in the chat box, and we'll give you an assessment to find your level and place you in an appropriate course as well. MG is asking advice on how to be confident enough and not to be distracted when you sit for the speaking test. Somehow I'm a bit worried and nervous. So MG, I would advise you to take your professional role. Can I know what profession you are? Are you a doctor or a nurse or a pharmacist or any other professional? Let me know. So whether you are, if you're a doctor, assume that you are doing the role of a doctor. What you do as a doctor at work, in the clinic, in the hospital. Okay, you are a nurse. So as a nurse, do what you do as a nurse. Or if you plan to work in a country like the UK, imagine that you are already in the UK, you are a registered nurse in the UK and you have a patient. So the interlocutor is your patient, and you're there to, you want to, make sure your patient gets the required care, and that will give you the level of confidence. You become stressed and nervous when you think this is a test. When you sit the test, make sure that you focus on your task, and that's what makes OET unique. OEM, right, so you can try one of our orientation classes, which is free. Okay, so thank you very much everyone for being part of this session, and I love the replies, the comments, and the interaction. Shadin has grammar issues in speaking. Okay, so you will have to, I can't give you a quick fix, but firstly, you will have to identify what are the grammar issues that you have. If possible, try to get a training, but also, you can even do a lot of activities where, you can drill and work on those areas of, grammar. IRS Group will very soon launch a grammar-focused course for you, so you can also subscribe to that course. We are launching it in a couple of days as well. All right, so thank you very much everyone for your lovely interaction, and this class is something which I enjoyed. So enjoy your rest of the day or evening, and yes, Judith, you can. And thank you very much everyone, and hats off to the great work you all of you do in the middle of this pandemic. And thank you very much. I'll see you on the other side of another All Stars session shortly. Have a great day. Thank you, everyone.